Administering the patient pathway doesn't sound like the most exciting topic, but it is. Processing patient data acts like the hospital's nervous system, sending vital information around the organisation, ensuring that it functions. Without this vital data, the hospital simply stops working. Patients won't get any care or treatment. So how do patients and this data enter this nervous system? Where do patients come from?
Main bulk of referrals will come into the trust via the GP. Other sources of referrals that would come into the trust for elective care could be via other hospitals. We are a big tertiary centre here, via internal consultants, referrals via A&E, so a number of areas in which the referrals can come into this trust. If data is right first time, it means that we have less retrospective validation. Patients then get seen in turn in time.
Making sure that patients get seen in turn, in time, is central to the administration of patient referral and appointments. Where is the hospital's administration nerve centre?
We deal with telephone calls from patients, and also we receive telephone calls from GPs if they've got any queries relating to a patient's appointment or pathway. We are the link between the patients and the hospital clinicians. We always check the patient demographics with them before we will start talking to them about either making an appointment, or if it's regarding dealing a query, we will always ensure that we are speaking to the right person and that we've got all the details up to date. It's no good having 4 telephone numbers on a record and actually none of them are the true numbers, so we have to make sure that it's correct. With the new Global PAS system, because we're able to see it on screen that is already a pathway open, we can then check it before we actually go ahead and do anything further. If we do see that there is anything incorrect in a patient record, whether we've received the referral as part of our 2-week wait team from a GP and they've updated the details, we're able to instantly do that on screen to ensure that the patient details are then up to date. Because it's all part of the patient access system, it means it's there straight away for the services as well to be able to use the correct information.
Details are all checked thoroughly by the patient access team on referral. How is our patient's position on their 18-week treatment pathway determined? The answer to this is the referral to treatment, or RTT status coding.
RTT status codes are entered in at various points of a patient's pathway. They would be entered in at the receipt of a referral. They would be entered at the checkout of an outpatient appointment, or a reschedule or a cancellation of an outpatient appointment. It's really important that the correct treatment coding is put into the system. It means that the patient is under the correct consulting team. If the wrong codes are entered in terms of referral to treatment codes, it could mean that the patient isn't seen in clinical priority order. They could be seen out of turn as to what their clinical need is.
RTT status coding is vital to patients getting the right treatment at the right time. What happens if patient data is entered incorrectly or not updated on the system? What if the RTT status code is wrong? What can the impact be for patients and the clinical staff involved?
If we don't have the correct patient details, then for starters, there's the risk of the patient not getting their appointment. The patient gets frustrated because they don't know what's happening, because they think they need to come to hospital and they never hear about it. For us, we're sitting there twiddling our thumbs, wondering why the patient isn't turning up. So I think there's a big risk here of patients not getting the care they need.
When the patient checks in, you must always confirm that the address is right, the GP address is right, and get as many telephone numbers as you can. It's so important to get the correct information, because go to the wrong GP or the patient will get notification of a follow-up appointment or any tests or things that were requested. It wastes admin time, and also it will impact on the cost to the hospital as well. It can delay the pathway and actually the treatment of the patient.
We are relying on EPR a lot these days, so we request tests electronically, and for that it's important that patients are registered under the correct consultant, because the results come back to the consultant. So if I request a test and it goes back to the wrong consultant, then I never find out about what has happened to that patient. So I think it's really important that with every time a patient comes to clinic, you update everything. If we haven't got the correct GP details, then obviously, the letter might go to a wrong GP who is going to wonder what it's all about because they have never heard of the patient or not referred the patient. And the GP who has, they won't hear anything, and obviously they won't then be able to continue the treatment that we recommend from clinic. So very often we say, we think this is what's wrong with the patient, could you please prescribe or arrange whatever follow-up. If they don't have that information, they can't do it, and it's again the patient losing out.
The clinician complete the outcome form, so it identifies the patient and asks you whether it will tell you whether it's a discharge, whether there's a follow-up, whether it's a continuation of the pathway for diagnostics, and it will also give an idea of when the next appointment should be. Delivery
of the 18-week pathway is a key objective for the NHS. It's written into NHS Constitution, so it is actually written into law that we offer referral to treatment within the AUHFT within 18 weeks.
Accurate administration of the patient pathway is vital for the health of the hospital's whole nervous system. When data is input correctly, the whole hospital works well. Patients get the care they deserve. Let's all keep working together to make sure that this keeps happening. All patients need to be seen in turn, in time.